Welcome friends. Today we are going to learn about pulled elbow or nursemaid's elbow. The pulled elbow is defined as the subluxation of the radial head caused by an axial traction or a sudden pull of the extended pronated arm, and it's a very common phenomenon. This pulled elbow is commonly seen in children between the age group of 2 to 3 years. It can be seen in infants also, but it is very rare after 7 years of age. This is the normal anatomy of the elbow joint. Here an annular ligament is shown, which is a strong band of fibers that encircles the radial head and retains it in contact with the radial notch of the ulna. A longitudinal traction on an extended elbow is the most common usual mechanism of injury leading to pulled elbow. That can occur by abruptly pulling up on a child's hand or wrist, or by swinging a child by the hands or wrists, or pulling a child by the hand or wrist who is pulling away. All of these situations can lead the annular ligament to become interposed between radial head and capitulum, and thus leading to pulled elbow. This is a 2-year-old child brought by his mother to the OPD with complaints that the child is not using his right hand after the child was pulled upon by his wrist with straight elbow. After I asked the child to move his right limb, the child started to cry and move towards his mother. So the reduction technique for pulled elbow or nursemaid's elbow is that to seat the patient on the parent's lap, and the patient's forearm is grasped with the elbow semi-flexed, while the thumb of the surgeon's opposite hand is placed over the lateral aspect of the elbow, and the forearm is first supinated. Here, I have placed my thumb laterally over the radial head to feel for the characteristic snapping of the ligament when it is reduced. I am supinating the forearm, and after supination, the elbow is hyperflexed. After you hear or palpate the characteristic snapping sound or the click, the pulled elbow is reduced, and after that the child becomes pain-free and he is able to do all the movements of the elbow which were earlier painful, the flexion and extension. He is also able to wave you a goodbye. If this reduction technique fails, one can do hyperpronation of the forearm, and if that also fails, one can do full flexion extension elbow motion and forearm pronation supination motion to the extremes, and this will usually resolve the outliers which do not reduce with usual mechanisms. Thank you.